Hi, if you suffer from a disc herniation, spinal stenosis, or sciatica, you're going to want to watch this. This is a unique treatment, not like your typical treatment. So we're going to start this young woman here who has a disc herniation at L5-S1. Show you how we treat that. Okay, first we're going to start her on spinal decompression, but we have something unique, this. So we're going to go ahead and start her here on our decompression table, and what we do here is we're going to strap her in. And what spinal decompression does is it's a computerized version of spinal traction or traction. You can have it done in your neck, you can have it done in your lower back. So this table helps, it's computerized, so it's spinal decompression. We're able to control not only the pounds of distraction force, but also the intervals. So how long we pull out and then come back in and to what percentage. So what we're going to do is we're going to set it at, because we've done this with her before, we're going to set it at 80 pounds of force, and it's going to pull out for about 45 seconds, and you'll see the table pulling out right here. So it's going to pull out for about 45 seconds, and then it's going to come in 50% and rest there for 15 seconds, and then it's going to pull out again and come in 50%. And again, we can change all those numbers. This is what we've built her up to and gotten her to this point. So we do it in increments, and we've got her all locked in here. Now, I'm just gonna pull this up here. Now for the secret sauce. The secret sauce is this. This is called cold laser therapy, but this is a special laser. It's called the MR5 Active Pro, and this laser is unique in the sense that it can find areas of inflammation. So we're going to search for any areas of either inflammation or soft tissue damage. And we're going to scan her back. So let's go ahead and do that. So I'm able, again, to just scan the back, and it'll notify me any areas of soft tissue inflammation or damage, and there we go, right there. I was too busy talking, so you didn't hear the beep, but we're gonna go ahead and dose that, and it'll actually tell me when it's finished dosing. So could be a minute, could be 2 minutes. And we're gonna do this while she's on the spinal decompression. And the spinal decompression just separates the vertebral segments, decompressing the disc and also taking pressure off the nerves as well. And this laser is great because A, we can scan and find the areas of soft tissue damage, but also because you're able to change it from a 50 to a 25 watt. We're also able to use blue light therapy, which is really good for somebody that has maybe a wound and it's infected, or you've had like dental surgery and there's, you want to make sure you don't get an infection in there. Blue light's really good as an antibacterial. How you doing here, okay? Mm-hmm. Good. So if you guys have any questions or comments, you're watching this video and you have any questions, comments, or you want to see a specific video on a specific condition treated with cold laser has a lot of applications. So make sure you comment below, and I'd be happy to create a video for you if we have any of those patients with that type of symptom, but again, or that condition. This laser can be used for so many different applications, from disc herniations to sciatica to other occipital neuralgias and other nerve issues. Everything from epilepsy to vertigo, you name it. So a lot of applications. Soft tissue damage, carpal tunnel syndrome, the list goes on and on. Achilles tendonitis. Okay, so this area is clearly inflamed. Does this area hurt you usually?
Mm-hmm.
It does, okay. So it happens to pick out the areas that are painful for her, but that's not really what I'm looking for. This machine sometimes will beep over an area that may not be painful for the patient, and that's okay. Yeah, we're going on about 2 minutes here. This is a 50 watt. There we go. It's finished. So you heard that beep. So we're done dosing that area. And it might light up again over that area or near it. We're going to scan it again in a minute. And there we go, another spot. So sometimes flexion distraction or Cox technique, which we're going to do for her after we have her off the spinal decompression, it could be a little bit much. You know, she's doing decompression, then she's doing Cox flexion distraction technique, and it can make people sore sometimes. And we haven't seen her for a while, and she just had a little bit of a flare up. And so instead of jumping right in, you know, we're going to ease our way in. This is our second or third adjustment. So. And the laser really helps to speed the process up, speed the healing process up, and it's just going to get you through the injury much, much faster. In fact, it'll get you through any injury 40 to 50% faster. Okay, it's spending a while here on this spot too. So anytime it spends over a minute dosing this area, it tells me that there's quite a bit of inflammation or soft tissue damage underneath. Now I hope you guys enjoy this video. We're not done yet. We're gonna show you how we do Cox flexion distraction technique. Oh, there we go. So, but, you know, if you get anything out of this video, I hope you guys give me a thumbs up, subscribe to our channel. We've got about 4 videos coming out every week, and if there's anything specific that you want to see or would like to see, please comment below and we'll do our best to get a video out on that topic, okay? Or stretches or exercises you want for a specific condition. Don't hesitate to comment below. We thank you. We appreciate all you guys, and without you, we wouldn't have this channel, so thank you. Okay, so now we're gonna, the timer ran out. I had it set to 5 minutes. Didn't think we would use all of that time up, so we're just gonna scan that back again, right here in the middle. Okay, now I'm gonna lift this up. I'm just gonna lift this middle piece up. Yep. And we're gonna go over that first spot again, just to make sure it's all clear, and there we go. Actually, this is just outside that first spot. You tender right there too? Mm-hmm. Okay. And she has one leg shorter than the other, so her right leg is about 12 or 13 millimeters shorter than the left, and when she runs, she gets a lot of hip pain on that left side. So what we do for her is adjust and realign the pelvis, take pressure off that bottom disc that's herniated, and she does really, really well with that. We've also given her a heel lift to put in the right shoe, in the short leg side, and that's not something we do with every case of a short leg, but for her it is. We might have, for example, somebody with a right short leg and a left scoliosis. We would not give them a heel lift. But if they had a right short leg with a right scoliosis, we may give them that heel lift. Okay, so really just depends on what's going on with the rest of the spine. In her case, a heel lift is a good fit for her. She's not all the way up to 12 millimeters yet. We're going to work our way slowly and gradually up to that over a course of maybe about 2 to 3 months. And this spot's still dosing too, so it tells me there's quite a bit of inflammation in here too, further out. And for any of you wondering if this hurts or if you feel anything, do you?
No, nothing.
No. Yeah, you don't feel a thing. You might feel a little bit of warmth, a little bit, just because the machine's been on for 10 minutes. That's it. The battery's working. We're going to go across the back here. And we found another side here. So, you know, the lower back, this is a 50-watt laser. So this laser, the treatment times are quicker. But you can see we're on our second, almost 10 minutes now. The back is a large area. So I like to be thorough with my work. So we make sure that we get the whole lower back region, including the top of the glutes, because those do affect the back, even though they're just below the lower back. So again, we're really thorough. The back is a much bigger area. It takes a little longer. If you're doing a smaller joint like an elbow or a shoulder or a wrist, the treatment times are much faster. If you guys have any questions or want to try laser, we actually have rental lasers. So we rent lasers out by the day or by the month or even by the week. And they're really effective. We show you how to use the laser for your particular condition and what programs to use. And then you take it home and you use it in the comfort of your own house, okay? So if you have any questions, we've done some videos on the rental cold lasers. You can certainly give us a call or email us for, you know, if you have any other further questions about cold laser rentals or even purchases, okay? There we go. And we're going to scan out a little bit wider here. This side doesn't seem to be as bad as the left side. Oh, there we go. I spoke too soon, huh? Okay. All right, so we're almost done here, and then we're going to go right into the flexion distraction technique. And that technique is the gold standard for disc herniations, degenerative disc disease. How are we doing there when the table comes back in? Any pain? So before this video started, she said, don't make me talk. Don't make me answer any questions. And as you could see, I've asked her a few questions, and apparently I don't follow the rules. I might ask you a really complicated question, you know? Okay. So this young lady has a flight to get on. We need to make sure she feels good the entire long flight so that there are no problems. Make sure that her back is an afterthought. All right, take a deep breath in and blow out. So folks, what I'm doing here is I'm basically just loosening up the iliocostalis and the quadratus lumborum muscles. These muscles surround the spine, and by loosening them up, I'm just going to get so much more out of the Cox Flexion distraction technique. It's really important to loosen the soft tissue up around the spine so we can get a lot of foraminal gapping. When I say foraminal gapping, foramina is this hole right here on the side of the spine where the nerve comes out. And you want to have a nice large gap in that foramina, that hole, so that the nerve isn't being pinched or chafed or irritated. And that's when you start getting pain shooting down your leg, sciatica, or you get numbness in your toes or feet. And we've been really lucky. We've been able to avoid that with her, and she has not had any problems with that since we've been treating her. Now, some of you choose to go get injections. I wouldn't do that. Spinal injections are just medication that treat the symptoms. It's like taking an Advil and ibuprofen, or even worse, painkillers. It doesn't fix the problem. This technique, Cox technique, gets right directly to the disc and nerve problem and addresses it directly. That's why it's the gold standard. Good. Now her left side tends to get much tighter, so I loosened up the left side first. Now, a lot of times we're supposed to tolerance test the patient, but I've already done that with her, and I'm going to save you from that boredom. But right now we're doing foraminal gapping. We're opening up the space in the back of the disc and where the nerve exits from the spine. And this is really comfortable for patients. If you're one of those people that has a really excessive curve in the back, like your butt sticks out, okay, this is also really helpful. That's called lower cross syndrome. This technique can be really, really helpful for those people. So if you're one of those people that sits down all day at a desk and you go to stand up and it takes you a minute or two to kind of stand upright and get yourself straightened upright, that means you have lower cross syndrome or facet syndrome, which is the top one in the middle on that poster. So facet syndrome, also very, very common problem with people that sit down all day, like this young lady who sits all day for work. And she has a degenerative disc, so that makes her more susceptible to sciatica and facet syndrome. And that's why this technique works so well for her. Okay, let's have your right side up. Straighten the bottom leg. And the other side up. So I don't always do this technique on people with degenerative discs or herniated discs. This works really well for her after we do the flexion distraction and spinal decompression. And on your stomach. Keep your legs straight. Raise one leg as high as you can, and the other one. Okay, is one leg harder to raise than the other?
No, that's fine.
Okay. Take a deep breath in and blow out. Okay, turn over on your back. I'm going to have you cross your arms in front of you. Okay. Good. Tuck your chin down. Take a deep breath in. Keep that chin tucked and blow out.
Yes.
Okay. Again, folks, if you have any injuries, any questions, anything, don't hesitate to comment below. I hope you like this video. I hope you give me a thumbs up. Subscribe to the channel if you haven't already, because we have a lot of good stuff coming out every week. Now, we're going to adjust her cervical spine. She gets headaches from time to time. She's had some head trauma, not recently, but she is susceptible to headaches, especially when she's working on the computer with clients too much, right?
Mm-hmm.
Ooh, that was a loud one.
Mm-hmm.
Hands up in the air. All right, have a great trip.
Thank you.
Thanks for tubing in, folks. See you next time.